Let me start Instagram here. Hello, everyone. Let me get this set up. This is Dr. Nelson. I am at Kills Health headquarters, which means I'm in his studio in his house. Uh, Thank you for being here. I am trying to go live here on Instagram. And now we're back. Okay. Uh, I see Juliette Marie, Sandra Martin, Tommy, Jordan, and people coming in. Uh, it's 3 o'clock on the 3rd of June, 3 Eastern time, wherever you are in the world. Just put it in the chat where you're watching us or listening to us. And if it's halfway around the world, welcome here. Today, I have with us Laura Buchanan. And forgive me if I butcher your name or last name,
No,
Laura,
that's
because
perfect.
my first language is Spanish, not English. So, Laura Buchanan is a double board certified physician in family and obesity medicine. By the way, I'm biased because I am a family physician, residency trained. So, uh, family physicians are the best.
I'm with you.
Even, even better than OBGYN and infertility specialists. Uh, Anyways, double board certified in obesity and family medicine with passion for using lifestyle modification as a first line standard of care. She's a certified metabolic health provider and a board and founding member of the Society of Metabolic Health Practitioners, of which I am also a member and MHP. She's also certified Menopause Society Certified Practitioner. Given the improvement she has seen in patients' mental health with low carb diets, she also completed Dr. Georgia Eats Ketogenic Diets for Mental Health Clinician Training. She completed her family medicine residency at Wake Forest in 2022 and was a valedictorian of her class at the University of Florida College of Medicine. The mission that drives her is to help people age successfully. The passion was initially derived from the love of sport, but has since evolved and expanded to include a passion for healthy living, generally including the importance of nutrition, exercise, mental wellness, and optimal use of the medical system. She sees her role as a doctor being twofold, promoting prevention and practicing medicine. She is currently accepting patients across the United States via telemedicine with Dr. Tro. You can learn more about her and Dr. Tro's practice at tour.health. Tour.health. And all that to mean she's probably far more intelligent than me.
I don't know if that's fair, but
Uh, Thank you for being here. Uh, we're going to talk about hyperinsulinemia and low carb, high fat diets, carnivore diets. And if anyone watching has questions, please put them in the chat and we'll try to get to you. It'll be easier if you do put QQQ in front of it because I'm by myself. So I'm going to be paying attention to Laura and learning from her and paying attention to the chat. Uh, all right. So, whatever I didn't mention here, Laura, can you tell us more about yourself and maybe a little bit of your own journey? Because you do follow a low carbohydrate diet,
I do.
sometimes
Yeah.
sometimes carnivore.
Mhm.
So you can go ahead.
Yeah. So I was passionate, loved sports growing up, and then primarily during high school, I was watching some people I loved age in very different ways. My granny, she lived to over 95, and she played tennis until she was 88 and continued to walk daily up until, unfortunately, she had a stroke in her mid-90s. But she lived a very full, wonderful life until she passed. And she was very with it cognitively and emotionally, just all around, and very active. And it was because of the way she lived her lifestyle. She cooked all of her own food, very minimally processed, and just, I think, lived a very healthy lifestyle. And then other people I watched who were struggling with diabetes and complications from their diabetes, and unfortunately ended up getting dementia and numerous other complications and having really struggling their final decade of life. And so seeing that, and it was really driven by their lifestyle habits, the very two stark contrasting end of lives there. And so that kind of motivated me to hopefully help people age like my granny, who I think she aged very successfully. And so in medical school, we had a nutrition course that was 2 weeks, and sadly, like many nutrition courses, is, I think, woefully inadequate. And so I was doing a lot of my own research. I actually came across the Low Carb MD podcast shortly after it was released, and then discovered Nina Teichel's The Big Fat Surprise, Jason Fung, The Obesity Code, and many other, Gary Taub's, great books. And that just really opened my eyes and realized, I had actually avoided red meat for almost a decade. And I'd eat it here and there, but pretty much tried to avoid it because I thought that was the healthy thing to do, until, I found and read and really started diving deep and reading the literature myself. And I realized we were misled. And so now I eat red meat.
Were you ever vegetarian or vegan?
Never vegetarian or vegan. Just like if I went out to a restaurant, I was typically going to get, I don't know, a salad, or I wouldn't go for the burger or the steak. And then in college, I actually played sports, and I played soccer, and I tried to eat like a lower fat diet, again, trying to be healthy. And I ended up my A1C in the pre-diabetes range, even though I was playing soccer, 5 times a week and exercising a lot, but I was just eating a pretty high carb and also processed food diet at that time. And so anyways, coming to med school, I learned all of this new information and realized this is the way to go. I got a continuous glucose monitor. I think the first one was actually my 4th year of medical school. And even though I thought I had started eating lower carb when I got my continuous glucose monitor on, there were still things in my diet that were spiking my sugar up to 180, actually on a regular basis. And I was shocked. And it was processed foods that were very high in fiber, and I was trying to up my fiber intake at that time. So it was these, again, kind of oatmeal bites, again, 8 grams of fiber, 2 grams of sugar. I was like, this is great. And my sugars were just going up like crazy. So the CGM was another eye opener for me. So when I graduated that year, going into family medicine residency, right off the bat, I was practicing low carb with my patients, helping them change their lifestyle, get off medications, and reverse their hyperinsulinemia, reverse their insulin resistance. And it was amazing. I was a really interesting journey, because initially, when I would see patients and I'd be recommending low carb ketogenic diets to them, I would get a little bit of pushback from some of my faculty saying, this patient's A1C is 10. You didn't start them on medications. They need medication. And I said, well, we're getting them a continuous glucose monitor. We're going on a ketogenic diet. We checked a C-peptide. They're fine. They're producing insulin. I think let's just see what happens. I'm going to monitor their sugars closely. I'm not going to let them continue living with an A1C of 10 for long. And then when they started seeing the results, I stopped getting that pushback.
When I graduated from medical school, which was a while ago, I learned that lifestyle changes, you should try them for at least 6 months in everything you're going to use them. And I do understand the push on medication. It has always been like that, more so in the past probably 20, 30 years. But you're supposed to give it a chance. Lifestyle changes don't happen the moment you say them in the office, right? They walk out, they go to the car, they go home. It's going to take a while to put them into practice. But the proof is in the pudding. What was happening with those patients that you sent home with lifestyle changes and no meds, were they coming back 3 months later with some results?
Yeah, absolutely. And so, I mean, some patients I was trying to see monthly, especially if their A1C was 10. I was trying to get a little bit closer follow-up. If I couldn't see them, just because sometimes it is harder in a residency clinic to get people seen that often, then I would typically do phone calls just to check in or shoot, send them messages. But yeah, I mean, I saw A1Cs drop from 10 to 7, 10 to 6. I think the most was an A1C of 14. And within 6 months, it was 6.5, I think. Um, and so, and then besides just the blood sugar improvements, you would see blood pressure following similarly. Sometimes it took a little bit longer for the blood pressure to drop, but you would see remarkable improvements in that. So able to get people off of both diabetes medications as well as blood pressure medications, oftentimes reflux medications, because a lot of the same foods that are triggering the reflux, you're removing for the other lifestyle changes. And then although my focus with all of those things is like primarily on the diabetes, the insulin resistance, and reducing their medication burden and improving their metabolic health, weight loss just follows naturally. And so with the weight loss that comes, that is another reason you see reflux and many other conditions to get better.
So I have a list here. I'm not going to go through them because it would take me a few minutes to do that, but about 30, and I know it's incomplete, but about 30 symptoms or chronic diseases caused by or exacerbated by hyperinsulinemia. So what do all these things, metabolic disorders, have in common in regards to the insulin?
So, and there's so many different mechanisms by which high levels of insulin can create inflammation in the body, cause damage. Some of the mechanisms, insulin directly, it has a negative impact on our blood vessel lining. It can decrease nitric oxide levels. Nitric oxide is great. It helps our blood vessels vasodilate. That's good, keeps our blood pressure low, keeps our blood vessels healthy. High levels of insulin, you will see increased sodium and water retention from the kidneys. That's going to drive high blood pressure. So I like the phrase that salt got blamed for what sugar did, and that's sugar drives hyperinsulinemia. Hyperinsulinemia makes those kidneys retain too much water, too much sodium, and you see the high blood pressure. Oftentimes, people also have a lot of bloating sensations or fluid retention in their legs, and if you push down on the skin in your calves, you'll see sometimes that it actually sticks. That's called pitting edema. And so all of those things are signs of hyperinsulinemia, too much insulin the body is producing. Why does the body produce insulin? It produces it in response to carbohydrate meals, any kind of carbohydrates. You can have more exaggerated responses to higher glycemic foods, so higher increases in blood sugar, but that is what is going to be driving the high insulin levels. And I mean, the list of what high levels of insulin impacts is truly across every disease spectrum. You may have heard Alzheimer's or dementia called type 3 diabetes. There's multiple mechanisms that high levels of insulin increase the risk for dementia, heart disease, stroke. Again, anything that's messing with our blood vessel function is going to impact disease for all kinds of diseases. But you see increased kidney disease with diabetes, which really diabetes, pre-diabetes are the next stages of just hyperinsulinemia. So usually you'll start seeing high levels of insulin, sometimes a full decade before you actually get diagnosed with diabetes. So or pre-diabetes. So very commonly when we are waiting or just checking A1Cs and saying, oh, your A1C is okay, you're fine, we are really missing out on helping people and catching people who have high levels of insulin, that we could prevent them in the first place from developing diabetes or pre-diabetes.
And correct me if I'm wrong, but the reason for that is your body's already dysfunctional, but your body's still handling the loads of sugar, right? So it is secreting or hyper-secreting insulin to try to handle the sugar, and it's keeping those sugars normal. So when you only check the A1C, Well, it's normal. You don't have any problems. Uh,
Yeah.
why do you think doctors are so resistant to measuring insulin levels? Because many people here, I can probably do a survey. Everybody's going to say, "Oh, my doctor didn't want to do it."
Yeah. Yeah. I think there's several reasons. One, we weren't taught it in medical school. And so they don't feel comfortable with that lab test. And there's, you know, which I can see some logic to this, but also maybe it should mean that you should do some investigating rather, is don't check something that you don't know what to do with the results.
And that's where I point at. I
Yeah.
have literally talked to colleagues that if I ask them, "Do you ever check fasting insulin?" I've had this conversation more than once in the past few years. They don't know what to do with it. So
Yeah.
it's high. They don't know what to do with it, and there is no specific medication currently. Well, there is the GLPs are probably the closest thing to be able to handle that, but shouldn't be the first thing. But most doctors don't know what to do with a high insulin level. They
Yeah.
know what to
And
do with glucose levels being high, which we call it diabetes. But uh,
yeah. And I think another issue is the reference range for insulin goes up to 25 on most labs. And so if someone maybe they are willing to check it because the patient asked them to, and they just look at the reference range and the patient's insulin comes back at 20, so fasting insulin, they might say, hey, you're good. It's in the normal range. But really that is if you've got a fasting insulin of 20, we've got some work to do on improving your metabolic health. And you're already kind of progressed along that spectrum of metabolic disease and going towards diabetes.
where do you like to see those levels? And a single fasting insulin level may not be the total answer either. You might want to check a glucose tolerance test with insulin or multiple
Yeah,
insulin levels. But where would you like to see
yeah.
the number?
So I like to see it less than 10, really closer to the 5 range. And there's certain times of the month, a woman's cycle, they might actually have a little bit higher levels of insulin because they're slightly more insulin resistant, higher levels of progesterone around during the second half of the cycle. And if you had a really bad, stressful night where you're rushing to the lab and you're running late, those little things, they could impact the fasting insulin. They're not going to make it go from 2 to 20, but they could make it go from 2 to 6 or 2 to 8 or something like that. So, like you said, I don't get totally hung up on a single fasting insulin level, but it is a great metric to trend and watch over time, and is very helpful. I really like it for patients to see, because if a patient has a fasting insulin level of 25, they go keto or carnivore, and then over the next 6 months, that fasting insulin goes from 25 to 14 to 7. That's really great improvement you're watching. And sometimes, I mean, you'll see it drop to 4 or 3. And so it's whereas the A1C during that time period for many people may not actually be changing that much. So you would just be seeing a static measurement to show them, oh, your A1C is the same as it was when you made these lifestyle changes. But this, you can really show the improvement. And just something to also think about, roughly 38% of adults have either prediabetes or type 2 diabetes, but 88% of adults have some component of metabolic syndrome. Metabolic syndrome used to be called insulin resistance syndrome. And so really almost 88% of the country, I would say, has some component of insulin resistance. Now, is everyone's fasting insulin going to be elevated? Maybe not, but it's a much larger population of people that you're going to catch that need additional help versus just looking at the A1C.
So, looking at those five markers, let me tell you about this patient, 58 years old, with high triglycerides, low HDL, hypertension on treatment, diabetes on treatment, and a waist to height ratio of definitely more than zero point 0.5. That was me in 2018 when I had a stroke. I, I created the perfect storm. Okay. I am down to one of those five. Everything
Uh,
else I have reversed to at least acceptable numbers. I still have some around my waist to work on, but I think I have decreased my risks of dying or having another stroke or heart attacks. Listen, I know I don't eliminate the risk, but I have tremendously decreased the risks. And
Absolutely. That's awesome. And that is huge on decreasing risk. There was
is it as simple as just decreasing carbohydrates, Laura?
honestly, sometimes it is. I think that's definitely a huge piece of the puzzle for so many people. And then I do think it's important to not forget, or, as we're working with people, we're thinking about sleep, right? Are you getting adequate amounts of sleep? Sleep is, I think, oftentimes underappreciated how important it is for our bodies. Stress management. Stress is something, someone can be eating great, but if their stress is out of control, that's going to really increase the risk for different diseases. And so stress, sleep, just emotional well-being, a lot of different things go into that. And then physical activity. I think exercise, it doesn't have to always necessarily be intense, but physical activity, keeping your body moving, that's something that very often maybe we're working on after a lot of the dietary changes are settled in, and someone's maybe lost weight if they've and physical activity is a little bit more difficult. But that is something that very often, once people have lost weight, they're actually like, hey, I think I'm ready to start doing this. And that's awesome. And so I think you get all of those things and you're in a really great spot.
All right, let's take a couple of questions here. Now, you can go ahead and answer and plug away. How do I find a metabolic doctor? Well, you found one here.
Yeah, no, I appreciate it. So two answers. Would love to see you. Tour.health. We're licensed in almost all 50 states between Tro and myself. But also, if you go to the SMHP's website, so that's the Society of Metabolic Health Practitioners. If you go to their website, they have a directory for people who are certified metabolic health practitioners.
All righty. Now, unfortunately, there are, in proportion to the number of physicians we have in this country, we are a very small number, but
Yeah.
you can find them. And like I said, this is one of the services toward that health. Okay. Um, I am sort of still a practicing physician, but I'm no longer seeing patients doing direct patient care, but uh, I'm still licensed and in Florida at least. Okay. So, what's the best way to go about getting hormone testing for postmenopause fatigue, hot, cold issues, and I don't care, LOL, being carnivore, ketovore since January 2025?
Yeah, so perimenopause can be a really tricky time to test hormones. I think you can do it. It's just because the hormones fluctuate so much, you might catch, for example, if I check your estrogen level, your estradiol could be 10, and then I would, oh, that's low. You're likely, further along in perimenopause. But I check it the next day, and your estradiol level is 300. And that's because during perimenopause, you have these huge fluctuations up and down in estrogen. Um, FSH can be helpful, especially if you are later in perimenopause. FSH, if you are, again, you're kind of later on in perimenopause, it's probably going to be higher than 25. If you happen to catch someone when they have a huge swing in estradiol during perimenopause, the FSH might actually be low, even though you are very well into perimenopause. So not a reason to not get them tested, just a reason to know that there could be some variation. So it's more helpful to see a very high FSH. But if it's normal, and that doesn't mean that you're not in perimenopause. So just be prepared for kind of the conflicting data that you might get. Definitely going based off symptoms can be very helpful. I think there's something called the menopause rating scale. I like to give all my patients that we're considering hormone therapy for, that are in perimenopause or postmenopausal, and that can really Again, it can just help guide things, but a lot of it's based on your symptoms and what's going on with your menstrual cycle. So if you are now having menstrual cycles more than 60 days apart, you are definitely, into later perimenopause. Whereas if initially with perimenopause, cycles actually sometimes get shorter and closer together. And that phase of them being shorter and closer together can last for a couple of years.
Okay. If you have any other questions, put them QQQ there. Now, at Toward Health, you're also, in addition to seeing regular patients that want to see you, you also have a program for employers. What is it that you do?
Yeah, so I really love this because we work with employers from the C-suite to the manufacturing line or employees. And so it's fun to just get to work with a very different patient population. But we have several different employers now that we work for, and we take care of their employees with the goal of kind of same thing with our patients, improve their metabolic health, help get them off of medications. And we actually just published, it's not actually been several months, but we published our 1-year data for one of the companies we've been working with. And so we had 50 employees. And between these 50 employees, over the course of a year, we stopped 96 medications. And the cost savings from stopping those 96 medications, from the employer standpoint, this is great, is almost $84,000, almost $1,700 per person based on Med D prescription. And what was awesome for the employees and as well as the employers, average weight loss was 43 pounds per person over the course of the year. And then what you don't get in just those numbers is the quality of life improvement that those individuals had. The stories of patients telling me they were able to ride a bike again for the first time. They could fit in their wedding ring again. They could go fly on a plane without asking for a seatbelt extender. They were able to go to the local high school football games because they could fit in the seats again. So these are the, like, really, I think to me, the most makes me just love my job really is seeing the improvement in people's lives.
Definitely. And I am a testament to that. 3 years ago, I was almost in a wheelchair having to get physical therapy, which I happen to have received from my son, who's a physician therapy assistant. But the thing is, I couldn't walk, probably 100 feet at the most. I would have to stop because of either numbness, tingling, pain, ridiculous symptoms. I have severe lumbar spinal stenosis with neurogenic claudication. And I couldn't go to a theme park. I live in Orlando, near Orlando. I couldn't go to a theme park for 35 years. I didn't go to a theme park where I wouldn't have to rent one of those electric scooters because I couldn't walk the park. Did it twice in the past 12 months. No, no, nothing. No cane. No, standing, walking around the whole day. Next day, got up, no pain. So that by itself, the quality of life, like you mentioned, it's, at this point, if I die, I may die tomorrow. I may die in 30 years. My dad was 92. His mother 93. His father 89. His grandfather 100. So I have that line on that side. Unfortunately, on my mother's side, life expectancy has not been as long. And in the lottery, in the DNA lottery, I don't know which one I got better, but at this point, I don't care as long as my quality of life is good until the moment it happens, and I can spend it with my family, my grandson. That's worth everything.
Yeah. Yeah, I love that. That is your story is really inspiring and just so happy for you.
And I have a grandson you have a son.
Yeah.
How old is he now?
Almost 2,
How many months?
23
How?
months.
Okay, so my grandson is 20 months. This month he'll be
Oh,
21 months. So it's just a couple of months younger than your son.
it's a
Uh,
fun age.
So spending it with him a few days ago at the beach was something that, oh, probably not possible even 3 years ago. So, anyways, let me see. A couple of comments here. I think I clicked the wrong one, but the girl grandma, this Papa Carnivore. My fasting glucose was a bit high though, 120. He did put in another comment, his recent labs, and I don't know if I'm gonna be able to find them. I think my doctor got upset with me when I said I'm not taking 3 blood pressure medications anymore. I told him I was getting dizzy and almost passed out because of blood pressure went so low. He took my BP and it was 120/75. So, Dr. Laura, do you remember that class about deep prescribing that you had in medical school?
I wish. Yeah, it's all about prescribing. There's
Isn't
yeah, the
isn't it
only
fun to tell a patient stop that medication?
it is. It's one of my favorite things to do during the day is stop medicine. And what's really cool too is a lot of patients, when you tell them that, they've been told that we're going to be on that medicine for the rest of their life. And so it's a huge sense of relief often that people get, oh no, you can actually come off of medications. You don't need them forever. We just need to, work on the right lifestyle changes. And it's unfortunate, but it is true that, again, these lifestyle changes can be very potent, and not all doctors are familiar or comfortable with titrating medications off like this, or knowing, if someone is doing this type of dietary change, that they need to be thinking about, and warning the patient and helping them with that process of what is the best way to take these medications off, so it's not the patient having to figure it out on their own.
So, how many patients have you? You probably don't have many because you're lucky in a sense. You found low carb very early before you were even a doctor. So your type of practice has definitely been in a different trajectory as many of us older folks. But how many patients have you had maybe come to you with this 300 units of insulin a day?
300? One.
How about metoprolol, 300 milligrams daily?
I think the most I've seen is 100 twice a day.
Yeah, that's what most doctors are comfortable, 200 a day total. I was on 340 of lisinopril, and I haven't taken blood pressure medication in 15 months. And when I do feel, I'm fortunate that when my blood pressure goes up, I feel it, because most patients don't.
Yeah.
And when I ask my wife, where's the blood pressure machine, and take it, I'm not feeling already well, and it's 130/70. Usually it's in the 115 to 120. But patients sort of never told you can reverse hypertension, you can reverse diabetes. By the way, my A1C 5.4 for the past year and a half. I'm about 6 times.
It's awesome.
Eliminated 7 prescription medications. I still take 2 of them because I want to, and there are reasons for it. But I wouldn't even need to take those other 2. So, and I take aspirin, which is not a prescription medication, but it is a medication. So, what do you think? How can we fix, if there's any fix in our healthcare system or sick care system?
I think that's a huge piece, right? We have to start changing the lens to a preventative mindset. And I've still seen patients who their primary doc has not checked an A1C in over a year, and then we check it and it's high. Same thing with other labs that thyroid sometimes is missed as well. So I think one is just changing mindset to prevention, which adding an insulin lab test is actually a great place to start from that. I think from the what would be wonderful is if the healthcare system as a whole started being a proponent for health food. And I say that I worked in the hospital, and what did we give our patients who had type 2 diabetes for breakfast? We gave them pancakes with sugar-free syrup. And it's like we are teaching them that that is okay to eat because that's what we are feeding them. But we are just making their disease chronic and progressive when that is the way what we choose to feed them. And so if we could instead in the hospital setting have at least an option of a ketogenic meal to offer our patients, which would just be a delicious breakfast of eggs. If you want to add some meat alongside it, do that. But so we need to change the food we're supplying patients, the food that is available. And at the clinic I used to work out, there was always bagels, donuts, candy, always in the workroom. So it's just this mindset that that's normal and almost expected, that people are just munching on candy throughout the day or munching on these very high carb, high processed foods on a regular basis is just part of our culture.
So where do you think that starts? Is that going to start within each individual person? Is it going to start with the doctors and nutritionists, or with government guidelines? I mean, where do we start to make that change? Because yesterday I saw a video that you must have seen it, because Dr. Trope put it on, at least on LinkedIn, I saw it, about the nutritionist recommending that you don't eat the whole potato, just eat half the potato that has 60 grams of carbs. Eat the half so you have space for the bread.
Yeah, so that is, I think it's probably going to have to be a combination, but I think grassroots movement, patients continuing to, I mean, I think there's some really good things about social media. The growing of the low carb, I mean, you could call it movement or knowledge of its the benefits it can provide people. Similarly with carnivore, and so social media has really helped, I think, expand people's awareness and made people more conscious about hyperinsulinemia and the risk of the higher carb food are triggering that problem. And then from a medical school, nutrition school, dietitian school, I mean, every layer of education, nursing education, there needs to be, I mean, the nutrition curriculums just need to be revamped. On things are slowly turning. The American Diabetes Association, actually since 2019 was the first time this was in their guideline, but then it kind of gets buried in the rest of the guideline. They said that low carbohydrate diets have shown the best evidence for improving blood sugar, but that is, that was 6 years ago, and it's still, that's, the best evidence. However, choose any eating pattern that a patient will stick with. And then the nutritionists that are and dietitians that are in my area, and like you just mentioned, who should, be nice if they saw those guidelines, or the low carb has the best evidence of glycemia. Instead, they're still being taught the same old stuff: 60 grams of carb at a meal, 15-gram carb snack, 3 meals per day with 60 grams of carb, and 3 snacks with 15 grams each. It's
And
a big.
that to me, if I were to eat that way, I will be back where I was.
Mhm.
Maxing out a few medications and perhaps using insulin, because I can't. I don't tolerate small amounts of vegetables, fruits. Basically, my diet are non-existent. I'm mostly carnivore, but part of it is just I can't tolerate eating too many. As a matter of fact, even having carnivore foods might be a problem for me. Like I cannot have milk or limit heavy whipping cream and cheese because it's too much. I don't tolerate. I'm intolerant to carbohydrates, but sometimes it's difficult explaining that to patients. And I was born and raised in Puerto Rico, so I've always attracted. I trained in New York. Always had a lot of Hispanics around me as patients, and it's very difficult to tell my people stop eating the rice and beans and the yuca and all the roots, or Mexicans and Central Americans stop eating the tortillas. At I grew up eating rice and beans twice a day. You know,
Yeah.
except for for the breakfast, all lunches and dinners were included rice and beans, even in school, which at the time uh, might still have been too many carbohydrates, but it was whole foods, by the way. When I went to, there was no ultra processed food being unwrapped and served. They cooked every day. Of course, uh, I went to school so long ago that at the time there was no history class. It was called current events. But so I think lunch curriculum, lunch food in the schools need to. Hopefully, there's going to be some change. I'm
Yeah,
hopeful because of the new, they are allowing us to talk about it, right?
yeah.
Uh,
I,
but
another good example, kind of actually two things you said that made me think of this. I was actually just looking at a local daycare in my area, and they said for allergy concerns that you could not bring in food, so the kids would just get the food that was provided to them. But they were happy to say that they only allowed USDA approved meals. And when I saw what they were eating for breakfast that day, it was Rice Krispies, skim milk, juice, and a banana. And I mean, where's the protein in that meal? That's processed, high, low fat. And like my 2-year-old doesn't need skim milk. It's crazy. And I don't think he really needs Rice Krispies either. I don't really mind the banana, but that's the
so what do
USDA
you
meal.
feed? What do you feed your son?
So his favorite thing. So I'll tell you what he had for breakfast the other day. He had the day we went to the daycare, because I was just contrasting these two in my head, thinking about the Rice Krispies and skim milk. He had lamb and butternut squash. And then, so one of his favorite things, he probably has it almost every day, not quite, is sardines, like a little puree of sardines that I make. And then he's pretty persnickety about what he actually will feed himself, so we still have a lot of purees, but he will only give himself meat, like steak, brisket, ribs. Like that's all that he will feed himself. Um, but we do have these organic purees that are fruits and vegetables. And he's super energetic and runs around all day nonstop. And he seems to be doing really good. So I don't have I'm happy with him eating those whole foods.
All righty. Uh, Let me see if I've missed any other questions here. I apologize because I'm by myself here, but we do have a question here. Let's see. All right. Scooby the dog, that dog, I believe Helen is her name. Uh, Fasting glucose 85, A1C 1.8, experiment A1C insulin 1.8. So I uh, don't know which one of the two is with the CGM experiment. And some fruit honey spikes very high, 170, 180, goes right back down 45 minutes, sometimes then below 7. Is this a problem?
So
Not
two,
stay elevated.
a couple of thoughts. So whatever your baseline is, say your baseline is 85. If you spike up high and then you go below that, like you said, you went from 85 down to 17 or even below 70, so you're dropping into the 60s. That's called reactive hypoglycemia. So your body released a large bolus of insulin. You're basically overcompensated and dropped your sugar below where your baseline is. And that can actually, even if you don't have symptoms, many people actually do feel symptoms. And this is where you hear people who have symptoms of low blood sugar, but they're not on medications and they don't have diabetes. And you're like, why would they have symptoms of low blood sugar? It's usually this reactive hypoglycemia. Some high carb meal is triggering a large insulin response, drops the sugar lower than baseline. And that can trigger the body to then release stress hormones, epinephrine or adrenaline, and glucagon, cortisol to basically bring the sugar back up to its baseline. So that is not a great thing for the body to have to do if that's happening on a regular basis. And so, and same thing, I think we will have much more data because continuous glucose monitors are so prevalent now, which will be great to have the data. But currently, there are some studies in people who have diabetes that if they have the exact same A1C and that they go into the hospital, have a heart attack, if they have more glycemic variability, so that means more up and down of their blood sugar above a 65-point swing. So you start at 100, you go above 165, then that puts you at higher risk for future heart attacks, basically. So there is evidence that damage is occurring if your blood sugar is swinging more than 65 points up. I wouldn't say the same thing if you're noticing that from an exercise spike, if it's coming down, but from food that has been shown again in that patient population. We definitely need longer studies looking at this because we don't have the data on young, healthy people who are eating higher carb foods and having these large ups and downs. We don't have outcome data on does that increase risk. But if we look at this other data for now, I would say precautionary principle, I would not want to see my sugar spiking up to 180 and then dropping below 70. And so if I'm, I still want to incorporate, say maybe I did want to incorporate a little bit of fruit in my diet, I might switch to a lower glycemic index fruit. So switch from grapes to berries instead, or potentially grapefruit or something that you just may not see that same type of excursion on, and decrease potentially the quantity of honey. Same thing if it's causing spikes up like that. Additionally, if you tie those around exercise or physical activity, you may see that it actually does not cause near the same type of increase.
We can have increases with exercise, like you mentioned, stressors like sauna or cold plunges. Usually, those would be more benign, if you would, compared to loading yourself with carbohydrates. And there are people out there who promote meat-heavy diet, and they have a lot of fruit. But I think prescriptions of therapeutic carbohydrate reduction or restriction depend on how metabolically sick you are. Diabetes, I consider it that like is the top of the chain. It's the worst metabolic condition, but things that you may not even think have anything to do with metabolic syndrome, like PCOS or things like that. The excess carbohydrates are priming the pump. Try to explain with patients. You keep doing that, and your pancreas continues to secrete insulin. Your body handles that for 10, 20 years sometimes. At some point, it breaks. It's like buying a brand new car. You can run it 100 miles an hour for a long time, but it's going to break down.
Yeah. I've seen people's A1Cs go from 5.8 to 9 in 1 year. It's because they hit that tipping point. Their body could no longer produce the insulin that it required to keep their blood sugars looking fairly normal. And the pancreas just tired out. And then all of a sudden the sugars go up dramatically.
All right. Let's see if we have any other questions. We have a hard end at 4 p.m. because we're doing another live 50 minutes later. But I think there's a comment here. Which is more harmful to health, sugar or seed oils? That's sort of a trick question.
Yeah. Me personally, I avoid both. In general, I think there's probably more evidence for sugar as far as outcome data, especially if someone, say, has diabetes. But I do think I myself avoid seed oils, and I think there's what's the book? Oh gosh, is it Callie Means? She published a paper that went through some of the mechanisms by which seed oils, vegetable oils, could be harming the body, damaging mitochondrial functioning, and so. I think because now especially we have the option of using things like Primal Kitchen or making your own homemade sauces using avocado oil or coconut or butter or ghee, and any of those options. I think I personally would just try to avoid them. I know sometimes you go to a restaurant, you can't avoid them unless you ask the chef to cook your food separately, which not everybody wants to do, which I understand. So, maybe most of the time you don't get any seed oils, but maybe if you're going out to dinner with family, you do get a little bit of seed oils.
And some restaurants, and I found this is my experience. I used to go to a restaurant often. I would still go, but now I know some information. I always ask, and I ask every time. They tell me the same answer: is your butter real butter? Oh yeah, 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 yeah. It's real butter. Come to find out from an employee that took a picture of what they're serving, it's a vegetable source,
Oh,
butter-like substance. Basically, it's seed oils,
yeah.
but the the people serving were they're not trained in that. I understand that, but oh, so now I know. Uh, Another restaurant, similar type of steakhouse this week. The guy said, "You know what? I'll be back." And he brought the cover of a tub. This is what we have. It was real butter. So I said, "Bring me some of that because that's what I put on my steak."
Yeah. Yeah,
Uh,
no, that's great. I think, we have to be our own best advocates. And, I've had patients who they say they cook eggs for themselves at home and they feel fine. Their sugar looks good. And then they go to a fast food place, they have an egg breakfast and they actually see their sugar levels go up a little bit. And then, they feel bloated and don't feel well. And it's very likely it's because of the oils they're cooking it in.
the oils they might add regular milk, which has some sugar.
Yeah.
They in my house, my son and me, if we're gonna make a scrambled eggs, we'll add some heavy whipping cream, a little bit.
Mhm.
But some people add just regular milk, which has
Yeah.
more sugar. Uh, Marcy Me asked, the notes mention MHP. We need more clarification. I'll let you take that.
Yeah, so MHP is Metabolic Health Practitioner. So that means you have gone through additional special training and done a lot of CME credits, basically continuing medical education credits to get certified. And so there's a couple of different pathways. If someone is interested in actually becoming an MHP, they can, again, go to the SMHP's website and they partner with the Nutrition Network, which has a lot of great courses available on their website, and they continue to put out new great content fairly regularly.
So, the Society of Metabolic Health Practitioners, Laura is one of the board members and one of the founding members of that. I am also a metabolic health practitioner because as soon as I changed my diet, of course, I started to dig deeper into the science of all of this. So I did that as soon as we could. I probably put 2,000 hours of CME in the past couple of years.
Yeah.
Uh, all right. So,
Yeah. The website is thesmhp.org.
and you don't have to be a doctor to do that, by the way. They have different curriculum through the Nutrition Network, and there's nutrition advisor courses, coaching courses. Uh, you can be a nurse. You can be not have necessarily any degree, and you can go through one of the courses and be certified. Um, and of course, we are going to have our own Kills Health coaching program here. So uh, stay tuned for that. Laura, where can we find you? Where can we go? Someone, of course, asked, well, how can we find a metabolic health provider? Someone who wants to retain your services, what do they do?
Yeah. So you go to toward.health, and then you can sign up there. If you happen to be an employee and you think your employers would be interested, we'd love to hear from you. We'd love to get to start working with another employer. Again, I think it's a really great opportunity for all involved in that situation. And you can find me on Twitter and Instagram, although I'm a little bit less active with James right now. That's my 2-year-old. We're staying busy. But you can find me at Laura Buchanan, MD.
All righty. And in the show notes, There's a little bit of her bio, and the link is there. There's also a link to the Kills Mighty Tribe. If you're not a member, become a member. It's free. One of the things we do is on Mondays we have a Zoom call at 5:30 p.m. Yesterday we had Laura Spath. In the past few weeks we've had Dr. Baker, Dr. Boss, many other good people. Dr. Ovadia was also a couple of months ago, I think. Uh, and maybe we'll have Dr. Buchanan here in one of those as well later. But the link is in the description. The meetups this weekend, we're going to Seattle, Washington. It's a Healing Humanity and Dr. Kilt's combined meetup. We're going to be there. We're going to be in Boston at the end of the month. And you can find all those meetups at drkilts.com or kiltsmeetup.com. All the details are there. And if you have the time, in about 15 minutes, Healing Humanity and Dr. Kills, we're going to have a joint live stream here on YouTube as well. Thank you, Dr. Laura, for being here.
I may add one other thing real quick. I forgot to mention, we also have an app called Toward Health. You can download it on the App Store. We have courses for diabetes, continuous glucose monitors, heart disease that you can get if you become a premium member. We also have a community, over 14,000 members on, just with the chat. So if you're looking for like-minded people who are doing this lifestyle change, people have struggles, people talk about it. We'd love to have you join. And we are this month also starting, it'll be free. It's a fasting course. So that'll be on Thursdays this month at lunchtime. So a no fasting lunch program. That's 12 Eastern.
And that's the app for Toward Health. Guess who's a member? So I check the comments. I rarely make a comment, but I do check the comments almost every day there. A lot of good information there. All right. So thank you for being here, everyone. And in about 15 minutes, we're going to be live again with Healing Humanity. Stay tuned. And thank you again, Laura, for being with us today. Okay.
Thanks so much for having me.
You have a great day.
You too.